So when I left treatment, I went back to see the consultant. It was quite an interesting conversation because I had been so dishonest with him, so I hadn't told him what was going on, and so he hadn't had all the facts. But he, interestingly, when I was in rehab, they took me off all my medications, even the antidepressant. I came out of rehab drug-free, prescription drug-free. And the first thing we had this discussion was he wanted me to go back onto antidepressants, Antabuse, acamprosate. And I said, no, do you know, I've tried that. It wasn't the right fit for me. It's interesting because I do offer some of these medications to the patients I treat because there is an evidence base for reducing the risk of relapse. So I'm not anti-medication, but for me at that moment, that wasn't the right path to go down. And he was doubtful that I could maintain my sobriety without them. And I'd said, well, I've got a different set of supports now that I didn't have before. And I'm not 100% confident they'll be able to do this, but I'm much more confident than I was before. So he continued to offer me supervision, which was good. I did ask him, why did you not recommend mutual aid to me? And he said, because there's not any evidence that it makes a difference.
Okay.
And actually, there was evidence at that time. This is 20 years ago, so the evidence wasn't as good as it is now. But there was some evidence around, and so what I said to him was, I'm your evidence that it makes a difference.
But also he should know all the options.
Yeah, to be fair to him, I don't think he did bring it up. He didn't dismiss it out of hand. I think my reflection is he didn't give it the value it deserved.
Right. Okay.
And I think, do you know what? I'm not condemning him. When I was a GP before recovery, I didn't give it the value it deserved. And a lot of practitioners who don't know about it don't give it the value it deserves. They don't, we didn't know. And argue that we should have known.
Yeah, but as you stated earlier, the level of training on a medical degree about addiction is minimal.